pastures. Happy Friday, everybody. Come on in the misty morning chill. Hi, Lena. All right, girl. I hope you're feeling fantastic. Let's see you to bed. You did. Come on in. The angels and sing my heavenly song. Hi, Nelly from Iowa. Hello, hello. Hi. Man, it's good to see you guys. I'm glad you're coming in. Come on in. Share with your friends. Swipe left to right, up to share. Listen to a little Phil Wickham this morning. This is Heaven's Song by Phil Wickham. Love him. It's great. While you're coming in, oh, hold on. Here it is. So good. In the misty morning chill. Ah, so good. All 6 of your kids are on here? Awesome. There I belong. Okay, so if you're getting on here, I'm going to just like blank out and worship. I'm going to turn down over. Here's my contact. Other social media. There you go. Twitter, YouTube, all the videos will go on to YouTube after this. Website. All right, enough of that. Ooh, bam, so good. All right, so if you're looking for some awesome like acoustic worship, look at Phil Wickham's sing-along CDs. He has 3. Sing-along 1, 2, and 3. And sing-along 2 and 3 are the ones I have. It's fantastic. Okay, fantastic, so good. All right, so disclaimer: I'm not covering your junk in this video. We're going to talk about progesterone and what the hormone does, what it does in the body, the top 10 functions. There's a lot, but I picked top 10 functions. And you're doing that song tonight. Ugh, I love the song, love it. So we'll be praying for that. I'm praying that your gig tonight is fantastic. But we're going to go through this, and I'm going to keep it a short video. It's not going to be that long, so I appreciate you taking time out of your day. And if you have no idea who this crazy guy is, blabbing on Periscope, I'm Dr. Jim Bob Hagerton. I'm a chiropractor in Texas. I love Jesus. I love people. I love, long walks on the beach with my wife, Cindy. I'm just kidding. I mean, I do. I love that. But my favorite color is purple. It's not true. It's blue. No, these videos are all about you. It's all about how your body was created to function, and that your body was actually created to function 100% perfectly. Not kind of, not sort of, not a little bit, but you were created for 100% function in abundance, okay, which is what I talked about a week ago. And so that's what I want to talk about with progesterone. I want you guys, you're awesome. Aw, see ya. You're right, I'm a fake doctor, so you better watch out. You see what I'm saying? All right, so we're going to talk about progesterone and what the hormone does, but you know what? Don't believe a word I say. Go look it up. Like, my specialty is in function and in physiology, but if you don't believe anything I say, then go look it up. Go pull up a physiology textbook and go make sure that you understand, okay? A faux doctor? That's right. All right, so let's talk about progesterone. I want to give you guys this. I want to give you guys the goods on how this works so you understand why it's important for balance. The body was created for balance. It's created for symmetry. The Father did not create your body for chaos. And I know it feels like that a lot. It feels like every day that things are so stressful and things get so chaotic that's normal. It's not normal. It's common. And we need to continually change what's normal in our brains and say, no, that's common. That's just not normal. Because normal is perfect. Normal is function. Normal is health. Normal is balanced hormones. Do you see what I'm saying? Like, that's normal. The hormone imbalance, PCOS, horrible symptoms with your menopause, horrible issues with your menstrual cycle, none of that is normal. That's not normal, okay? All of that is common, though, because of the culture we live in and the stressors we have put ourselves under, okay? So let's talk about it. Now, the production of progesterone actually is twofold, okay? There's two different parts of the production of progesterone, okay? One, the progesterone itself is produced by the ovaries, okay? It's secreted by the ovaries, specifically during the second half, okay? Specifically during the second half of the cycle. So days 14 to 28 on a typical woman's cycle, days 14 to 28 is when the majority of the progesterone is actually secreted by the ovaries. Once a woman becomes pregnant, if she's, if she conceives, then the majority of the progesterone at that point in time is actually secreted by the placenta. So there's some different cells that actually secrete it then. There's different functions to it though, and I'm going to show you that in a second. So secretion is one part, secreted by the ovaries. We're not going to talk a lot about function of progesterone in men, even though we do have progesterone. We're going to specifically talk about the function in women. I'll give you a couple of things that the progesterone functionally does in men, but let's stick primarily with women, okay? All right, so the second half of production of progesterone is the stimulation of progesterone, and the stimulation of it, the stimulation that actually tells the ovaries what to do, is actually caused by the pituitary gland. So in the middle of the brain, the pituitary gland sends a signal down to tell the ovaries what to do, okay? I can totally do that, Hope. I can totally cover that, yes. That tells the ovaries what to do and tells them to produce, okay? Tells them to produce progesterone or estrogen or whatever, okay? Now, the way that the body is designed is once the ovary secretes the progesterone, okay? Once the ovary secretes the progesterone, then if they do their job correctly, if you get a signal from the pituitary gland like you should, then that hormone goes out into the body, does its thing, and I'm going to show you, okay? Yes, not all women have typical cycle. That's exactly right. It's 28 days is what the textbook says. Most women I know and that I take care of and I see and that I see as patients, that's not it. Okay, so, and that's okay. But the second half of a sort of typical cycle is when progesterone comes up, okay? But on that production side, as the hormone goes out into the body and does its thing, once it's done its thing and it's finished, then it sends a signal back to the brain to tell it it's had enough. The pituitary gland turns off and you're supposed to stop producing progesterone, okay? And that's typically how it works, all right? Now, that's not how it usually works, and that's not how a lot of people's works, but that is how the design is meant, and that's how the function and the physiology of it works. So, secreted by the ovaries, stimulated by the pituitary gland, okay? This will be on replay on YouTube, okay? So, if you are on YouTube and you're watching this on replay in the next few days, thank you for taking time. I appreciate that. Yes, the hypothalamus pituitary axis, the HP axis, is exactly that. That is the axis, that's the pathway that starts the production of all of the different hormones, okay? Now, let's talk about that as far as menstruation and when that starts. Let me show you that on the function, because that way you can see how it plays into these time periods, okay? So we'll talk about a little bit about that too on the menopause, right? Progesterone, yep, we're talking about it. All right, so different functions. I'm going to give you my top 10 functions. There are more than this. So please hear me. There's more than this that happens in the body in women and men, but these are just top 10 that I picked out of there to go over for you guys and picked out of the text and stuff to show you guys all the things that progesterone does, okay? And then I'm going to show you what happens in our society and the way we've set it up and why there are so many problems. Yes, you can call our office for a phone consult. If you go to the info on the actual website, phone number is on there, family-wellness.com, and then I can totally do phone consult for you, okay? That's why I'm not covering your specific things on here, because that way I can do it and I can do a good job, and I'm not crossing any lines and everything as we do a phone consult. So I'd love to do that for you, okay? All right, so number one, these are in no particular order, okay? No particular order. Number one function, stabilize the lining for possible implantation of egg, okay? Possible implantation of egg if on that second half of the cycle, and stabilize or thicken the lining during pregnancy, okay? Now, so here is one of the biggest things. Well, I love you guys. Y'all are awesome. Here's one of the biggest things all right, the biggest things that happen with progesterone release, okay? One of the biggest things that happen is that progesterone is important for thickening and stabilizing the lining of the uterus for implantation, okay? I'm gonna hold this up so you can get all of these four, okay? Get a picture. For implantation, and if implantation happens, okay, so when we're talking about fertility, okay, when we're talking about fertility, if a female has sex inside the window, like that 3 to 5 day window, okay, when she ovulates. So typically, again, around days 14 to 17. Doesn't always happen that way. That's when it's supposed to. So days 14 to 17, if she actually fertilizes, and that egg is going to implant, okay, that egg is going to implant. The reason that the egg can implant correctly and stay, all right, and stay successfully is because of progesterone. Isn't that incredible? Like progesterone, estrogen increases fertility. Estrogen is the one that increases the actual strength and of the egg itself, of the ovum. Estrogen is what matures the ovum. It's what actually starts and stimulates ovulation. Then once ovulation happens, if that happens, progesterone is the one that actually creates, okay, the implantation and stabilizes it because of it thickening the lining of the uterus, okay? That's important. Now, if a woman is having her cycle, okay, but she's not getting pregnant, or she's not trying to get pregnant, or let's say it's a teenager and they shouldn't be trying to get pregnant, you know what I'm saying? Like it's just a regular cycle, no pregnancy, okay, no fertilization. Then the second function, progesterone initiates the sloughing or the bleeding phase. So the second half of the cycle, when you actually start menstruation, okay, progesterone initiates menstruation if there's no implantation, there's no fertilization of the egg. So what happens is the signal happens where if there's no fertilization, the progesterone signals the body to start menstruation to create the sloughing phase, which is that second half of the cycle, okay? Right, no teenage. Second half of the cycle, so that the body can go through a full cycle and get back, full revolution on that, and reset and get back to the beginning and reset and get ready for another month, another fertility cycle, another set of hormones. Okay, and that's the purpose of it, okay? Lena, you know, the way that I recommend testing for hormone balance is through saliva. You can do blood testing, and sometimes you can compare the blood and saliva. Those are really good, but I like saliva the best because it's way more functional. Saliva will give you really functional levels. Now, we carry saliva tests in the office. We can get that for you here at our office. There's other doctors that carry it. Diagnostics, TECHS, is a company we really like for that. So that's one on there. Okay, number 3 function. It's important in blood sugar balance, okay? It's important in blood sugar balance because did you know, and then this one says it's a natural diuretic, okay? Progesterone is a natural diuretic and it's important in blood sugar balance. Did you know, okay? Yes, I'm going to talk about what happens when it gets off. I'm going to talk about different problems, okay? Yes, I am. I was like, hold on, I got to look at it real quick. I'm going to talk about problems. If the progesterone is not high enough and you've got more estrogen than you need and you've got more stress, no, you're good. Thank you for asking. If you've got more stress than you should, then your blood sugar can get out of balance because the cortisol levels and the neurology are so far out of sync that it creates blood sugar imbalance and spikes and valleys. And so the blood sugar never stays stable. Having adequate amounts of progesterone helps to keep the hormones level so that they're not creating more stress on the body and driving your body further. Now, if your blood sugar doesn't stay stable, what doesn't stay stable? Immune system. If the blood sugar doesn't stay stable, your immune system takes a hit, okay? Your gut takes a hit. Everything, that's right, Packard, everything takes a hit. So many things get affected if the blood sugar isn't good. If blood sugar doesn't stay stable, your adrenal glands can't stay stable. You get more stress. You get more hormone imbalance. You get more issues with protein absorption. You get more issues with fat production, fat cell production, and glycogen stores, which is what it talks about in digestion. And so that's where you want to really look at. Making sure that that's not a main issue. Low progesterone triggering hypothyroidism. Well, look, here's how this will happen. Low progesterone triggering hypothyroidism, the way that could work, again, thyroid is highly dependent on adrenal function. Low, I'm going to go ahead and show you this because I'm going to skip ahead and then I'm going to give you more function because you guys are asking good questions. You ready? You want me to show you what low progesterone causes? You ready? Low progesterone, and this encompasses all the things, especially in America. It's kind of a cultural problem. Low progesterone causes high estrogen. Low progesterone causes high estrogen. Okay? So there's two different types of estrogen issues. Water's good. There's two different types of estrogen issues. Is it the same thing with high progesterone causing low estrogen? Sometimes. It's a seesaw. Sometimes. Yes to that, Robin. That's a good question. And yes. Okay. There's two types of estrogen dominance. Okay. There's actual estrogen dominance, where the estrogen just goes really high. All right. Second type of estrogen dominance. It's called, hold on, wait for it. I actually wrote it down for you. The second type of estrogen dominance is called relative estrogen dominance. Relative estrogen dominance. Now, relative estrogen dominance, what happens with this is where, this is where the progesterone just goes way low. Like you don't have enough progesterone, you're not getting enough, your body's not producing enough. And you can create estrogen dominant problems just because your progesterone isn't great. So here's all the things that estrogen dominance causes. You ready for this? Autoimmune disorders, joint irregularity, joint instability, PCOS, fibromyalgia, digestive disorders, neurological disorders, anxiety and depression. Can I go on? Muscle and joint pain that's unexplained. All the things. Dysmenorrhea, amenorrhea. Do you see what I'm saying? Like estrogen dominance can create all of those different things. And so in order to make sure the body has what it needs, you've got to balance it, and you've got to keep your progesterone and your estrogen really stable. Okay? Now, estrogen dominance is caused from high stress. Like high stress will cause it. Dietary things can cause it. Environmental toxins can cause it. So one thing to help make sure that the estrogen doesn't get too high and create symptoms is to keep your progesterone high. To keep your progesterone up. So that's why so many times women need to support their systems with products that help promote normal progesterone release. Because if they're not, majority of the women in America already have estrogen dominance. Majority of the women in America already deal with this. And so majority of the women already are having those symptoms and stuff. Do you see what I'm saying? Okay, so let's do the fifth functional thing. I'm going to give you the next 5. Right here, get a picture of these. These are more functions of progesterone. Y'all are asking great questions today, okay? Yes, Gentex, we do saliva testing in our office. So we use saliva in our office to test for levels and stuff, and it's really accurate, so we use that. That's what I recommend. But yes, we do those tests at our office, just to answer your question. A lot of offices do, you can do it, but I do the testing here on saliva. All right, so here's function. Increase fat burning. This is function of progesterone, what it should be doing. Increase fat burning, okay? You're welcome. Stimulate bone formation. Stimulate bone formation. Why do you think as you get older and you get closer to menopause and your hormones get off balance that bones get more brittle? Right? Like why do you think that the bones don't keep forming and you get osteopenia and osteoporosis at the same time? Hormone balance is key for that. Physical activity is key, but hormone balance is very, very key. Yes, you can totally have too high progesterone. It can cause digestive problems and other stuff like that. That's just not the norm in America. Can it happen? Yes, it can totally happen. And it's something that can come up. Does it usually happen? Not in America. In the United States, normally it is normally your high estrogen. That's normally what comes up. Okay. All right. Number 7, decrease inflammation. Okay. And helps prevent autoimmunity. This is progesterone, what it's supposed to do. Number 8, help balance and support the thyroid. So you guys had asked about hypothyroid and underfunctioning thyroid. Okay. Number 9, normalizes blood clotting. Number 9, normalizes blood clotting. And number 10, which is probably the most important thing, if you're married in here, to your husband is it normalizes and helps to normalize libido. Helps to normalize libido, okay? Now, estrogen, interestingly enough, doesn't have anything to do with your sex drive, but if estrogen is really, really high, then your sex drive isn't where it needs to be. So your libido, I don't know who come up with that word. Who made up the word libido for sex? Really? Like, just call it sex drive. Like, I don't even know why you call it libido. That just sounds weird. You know what I mean? I hate that word. So I don't know why they called it that. Like, I just call it sex drive. So how fascinating is it that as the estrogen goes up, women don't desire sex as much. They don't want sex. Sex can become uncomfortable. They can get vaginal dryness. They can get soft tissue changes. Their hormones don't balance out. Sometimes when the estrogen is too high, even arousal can make them sick at their stomach because they get such a dump of hormones. Do you see what I'm saying? Like they get such a dump of hormones that their body can't handle it. Okay, so progesterone is one that regulates all that out. Now, estrogen is super important for emotional stability, like giving you the emotions you need, for all kinds of stuff. It's super important for fertility, super important for starting your menstrual cycle, but it's all about balance. It's all about balance, okay? All about it. All right, now, okay, would increasing progesterone cause the thyroid to heal? That's a great question. If the trickle-down effect, if the thyroid is getting stressed out because of the hormone imbalance and not having enough progesterone, then the body is perfectly designed to heal itself when you give it what it needs. So if you increase progesterone and the hormones balance, then it's going to take those, yes, on the breastfeeding. It's going to take those, okay? It's going to take those stressors away. It's going to take those stressors away, and the thyroid can heal itself if it's able. You were told your thyroid was dead. Well, it depends on the testing and what's going on, okay? It depends on the testing and what's going on. Oh, you're cute. Block. Okay. All right, you ready? Let's talk about, we talked about all the different functions. Okay, you ready? Let's see. We talked about relative estrogen. Okay, relative estrogen dominance. Will increasing progesterone help post-menopause? Menopause is different because you have to really see what the woman needs. One of the things that causes most of the symptoms post-menopause is that they don't get enough help from the adrenal glands to help them transition in. I did a whole video on this, to go see it on YouTube. And so hormone imbalance period creates all of the symptoms in menopause in that stage. So if the progesterone is low, sure, you can add it in post-menopause and it helps with bone support and it helps with everything. First step when you find hormone imbalance is getting the baseline set. And I'm going to show you that. That's a great question, Lena, okay? So the first thing to do is to really balance out diet, okay? Yes, any kind of support, any kind of hormonal support can make you feel more emotional. So if you're doing supplements, if you're doing something to help with your hormones, and you start to balance out, you want to really pay attention, okay? You want to really pay, oh, is that what it is? Libido is the Latin word for desire? Well, that makes more sense. I don't like it. That makes a lot more sense though, because I'm like, just say sex drive. Like, we have to make all these like cute little medical terms on it. I'm like, I don't even know why. That makes sense. See, I even learned things from you guys. That's awesome. Okay. All right. So if you're balancing out hormones, pay attention to your symptoms. You really want to use your symptoms as a guide as to whether or not, as you support yourself, you're doing better, or you need to kind of balance out and back off a little bit. So as you start to support your system, if you start to get over emotional and all of a sudden you're like ragey, or you're like, because watch this, progesterone and testosterone, both of those hormones are have more receptors on the left side of the brain. Neurologically, progesterone and testosterone fire the same pathways. So as you get a lot of progesterone in your system, if you're eating well, you're supporting well, and the progesterone goes up, sometimes you know when you've had enough if you start to want to break people in half. And you're like, ooh, you know, and you're like, dude, I'm turning into the Hulk. Then you know, like, I need to like back off a little bit, okay? If sex drive goes up too much, if you're like, this is a little weird, this is not me, you know to back down a little bit, okay? And so that makes more sense, so just pay attention. All right, so there's three main things, dietary-wise, super simple. There's a lot of different things, okay? Super simple. And so there are three things I want you to pay attention to about your diet and about daily things to feed your system what it needs in order to make sure your body can build up the hormones, okay? Ready? All right, hold on comments so you guys can see this. All right, number one, increase healthy fats. This is dietary things, just basic stuff. Okay? Basic stuff. Yeah, we talked about PCOS a little bit, Jenny. Increase healthy fats. Decrease your sugar. This is the main thing. You really got to watch your sugar. And plenty of water. Hydration, less water, more fats, more good fats. That really is, I mean, it's that simple on things to really feed it. You need the protein, of course, but those are the three that are the main ones. If your sugar gets too high, which typically, remember we're talking mainly to the women here, guys do the same thing, but with women, if you get stressed out and you go towards sugar and your sugar goes too high, your estrogen is going to spike. It will drive up estrogen because sugar creates fat storage. It creates glycogen, which is going to increase estrogen, okay? Which is going to increase estrogen. And so then the more estrogen you get, the more fat cells you build, okay? Then you have problems with craving fats and sugars because you're creating more stress, you're creating more cortisol release, you're creating more blood sugar imbalance. Do you see what I'm saying? So what you want to do is, now they, like Jenny on that, the reason that they recommend metformin on PCOS is they're grasping for straws trying to balance out blood sugar because they know that blood sugar plays a huge part. And PCOS, polycystic ovarian syndrome, the reason they call it a syndrome is they just throw everything in this big bucket that they don't really know what it goes to. Do you see what I'm saying? Like it throws in and they just throw everything in, all the symptoms that they don't know what it is. And so then what ends up happening is they're like, let's play whack-a-mole. Let's just use a medication to try to drop something down. So they try to regulate blood sugar, but it's the estrogen that's the problem. That's it. It is the estrogen that's the problem. You got to go back and look at that, okay? All right, so three main products that help with this, like on a base level, just three basic products, very global and vague on this. But I want to show you this. Amber, I did not cover healthy numbers of progesterone because I'm not so much on the numbers as when the spike is and when it goes down. On the saliva testing, it depends on where you are in your cycle. That's why I like saliva testing better because blood analysis, a lot of times they don't take the blood sample when you need to during the cycle to really test it well. The saliva testing is more accurate because you do a collection either through the whole month if you're cycling, or if you are in menopause, there's a specific way that you do the saliva testing so that you know what your hormones are doing. Does that make sense? So the levels are really different and it kind of changes because none of you follow a textbook. All of you are perfect. All of you are unique. All of you are created by God to be incredible and special and amazing. So I don't like normal levels. You should be at 200 or you should be at whatever. That's not it, okay? Does progesterone lower androgens? No, not necessarily, okay? It depends on how much you're getting in. It depends on your levels. Does that make sense? Because your androgens, like your testosterones and your stuff like that, and talking about your adrenal glands, the progesterone, like you're balancing out hormones to create system calmness really overall. And so it shouldn't, but it depends on if you're doing synthetic versus natural support. That's one thing I wanted to bring up, okay? How do I say this? Synthetic changes on progesterone, doing like a progesterone cream that's a synthetic or doing a hormone replacement therapy with synthetic stuff. You got to be really careful with that because you could create problems with that because that is driving a hormone pathway more than what it was trying to be driven. And it's not allowing your body to regulate it. Does that make sense? If you're using something that is natural, like wild yam complex, wild yam cream, yes, like wild yam complex, wild yams, there's a lot of companies that have a wild yam complex. That's a good one that is really good at helping balance out progesterone. Fish oil is important for all hormones. B complex is really important to make sure that you're balancing out your neurotransmitters correctly and you're really connecting all those pathways. So there's a lot more than this. This is three main things I wanted you guys to really see to make sure of, okay? Now, one of you guys asked about birth control. Okay, remember, birth control is an estrogen medication. It increases estrogen and keeps estrogen really high. So one thing to really pay attention to is if you're supporting and if you are adding in progesterone support supplementation, okay, no, you don't want to do progesterone supplementation in men. Like, you don't want to do that. You want to do more things to support testosterone release in men, like tribulus herb is a really good one, and just physical activity. You don't want to do progesterone support in men. That's not necessary, okay? Now, Saliva testing, Becky, we do saliva testing here. We can mail them. We mail them all over the country. You can do that. You can use too much wild yam, of course. Like you can use too much support. If too much progesterone gets in your system, that's where you talk about like the emotional imbalance, the raginess and stuff like that. Does that make sense? But no, talking about progesterone, supplementation and balance, and birth control, the issue with that is the birth control is increasing estrogen, and if you're increasing support for progesterone, you're kind of throwing it off. I don't know that they actually know what will happen with that, and so you might have some unwanted pregnancies if you're trying to not. I don't agree with birth control anyway, so that's a whole other scope for another day. The tests that you do for the saliva testing for hormone balance run anywhere from about $160 to like $320. That's what it normally is, okay? Tribulus herb I like from MediHerb, M-E-D-I, okay? M-E-D-I. All right. What about toxicity of fish oil? If you're getting a really good quality fish oil, you should not have problems with toxicity. We use Innate Choice. That's a company that we like a lot. Innate Choice, I-N-N-A-T-E. It's the purity level on it's great. The ratios of it are fantastic. And then you won't have that problem. Okay? Yes, Lena, you can totally do that on the phone consult. Would totally do it. Okay? Yeah, Indie Oils, that was an awesome product. We used that one too back in the day. I know it. All right, so I hope this gave you some good information on, yes, Packer, during your period, yes. I hope this gave you some good information on progesterone as a hormone, what it does in the body, and a bunch of different things it's responsible for. Go back, watch this over again. I want you to understand it. I want you to understand that your body is created fantastic. Your body is created so perfectly, and as long as all of the different puzzle pieces are where they need to be, your body can do what it needs to do. Okay, it can do what it's created to do. So learn this stuff, baby steps, little things that you can do over and over, little daily things in order to help your body work better, and you'll get there. You guys are fantastic. You know, the hormones are a tricky thing. If you need help, call me. I'd love to help you. I want you guys to function. I want you guys to understand how well the body is made. I want you guys to own it, and I want you guys to experience it, what it's like to feel good. Some of you guys have felt horrible for so long that you think that that's normal, and it's not. Hear me again. I think I'm going to, hold on, is this thing on? It is not normal to not have hormone balance and to not feel good. It is not normal. It is common, it happens all the time, but it is not normal for that. So if your hormones are out of balance, get some help on it, okay? And that way you can help your body work better. You guys are amazing. Peace out, have a good day. I'll try to get on this weekend. If not, we'll be back on first of the week. And remember, health is simple. It's just not easy. So we'll talk to you soon.